Hello and welcome. So first of all, our superficial inguinal ring. It is also known as external inguinal ring. So it is basically almost triangular shaped opening present in the anterior abdominal wall, specifically aponeurosis part of the external oblique muscle. As you can see in this photo, almost 1 centimeter above and superolateral to the pubic tubercle. It is medially bounded by the pubic crest, laterally pubic tubercle, and inferiorly by the inguinal ligament. That's it. And now the deep inguinal ring. It is also known as internal inguinal ring. Okay, so it is basically a oval shaped opening present in the fascia transversalis, specifically in between the midpoint of the inguinal ligament and mid-inguinal point. Okay, it is bounded by the superolaterally fascia transversalis and inferomedially inferior epigastric vessels. Okay, I mean inferior epigastric artery and inferior epigastric vein. Okay, so this is the boundary and the position of superficial inguinal ring and deep inguinal ring. In between superficial inguinal ring and deep inguinal ring, there is a hollow passage. Okay, it's a gap area or a passage, canal shaped. So we call it is a inguinal canal. It is almost 4 centimeter in length and directed downward, forward, medially. Okay, so in boundary, in anterior wall, you will get the skin, superficial fascia. You know the two layers of superficial fascia of my short video. I mean fascia of Kemper, fascia of Scarpa. Anyway, and aponeurosis part of the external oblique muscle. In laterally 1/3 part of the internal oblique muscle. Okay, and posteriorly you're going to find fascia transversalis and extraperitoneal tissues along with the parietal peritoneum and medial 2/3 part of the conjoint tendon. Okay, the roof is formed by the arched fibers of the internal oblique muscle and the transverse abdominis muscle, and the floor is formed by the inguinal ligament along with the lacunar ligament. Okay, I will talk about these things later. Wait, now the main point, when the examiner asks you in Viva, what are the contents of this inguinal canal? You have to ask only two contents. First of all, ilioinguinal nerve and then spermatic cord. Your examiner will ask you, what are the components of the spermatic cord? Well, I talked about these parts in the testis part of my video. You can check that. Now, extra additional knowledge point for you. What is inguinal ligament? It is also known as Popper's ligament, as you can see in this photo. Basically, it is made by lower part of the thickened portion of the aponeurosis of external oblique muscle, or basically external abdominis muscle. Now, it extends from anterior superior iliac spine to the pubic tubercle. The average length ranges from 12 to 14 centimeter. And secondly, lacunar ligament. What is lacunar ligament? It is also known as Gimbernet's ligament, as you can see in this photo. Now, it is actually triangular in shape or almost arch shaped. It extends posteriorly and a little bit upward from the inguinal ligament to the medial part of the pecten pubis. The apex is formed by the pubic tubercle, base is free and little bit convex shaped, and the medial part is formed by the femoral ring, mid-inguinal point and the midpoint of the inguinal ligament. What are these things? First of all, mid-inguinal point. It is the center point in between the anterior superior iliac spine and the pubic symphysis. And the midpoint of the inguinal ligament is present or is the center point in between the anterior superior iliac spine to the pubic tubercle. So I hope you a little bit understand, and see you soon with my next videos. Till then, bye.